corneal degenerations. So what is a corneal degeneration? So corneal degeneration is a condition in which the normal cells of the cornea undergo degenerative changes under the influence of some external or internal factors, that is either because of age or due to some underlying pathology. Okay, so this is a corneal degeneration. So depending upon the location where this degeneration occurs, it can be divided into axial and peripheral. Axial and peripheral corneal degenerations. Coming to what are the axial corneal degeneration, we have number one is fatty or lipid keratopathy, in which the lipid is deposited in the cornea. They can be yellowish deposit in the cornea. Then we have hyaline deposits. So they can be either primary, which occurs due to corneal diseases like granular dystrophy, and secondary deposits occurs unilaterally and are associated with keratitis. Then we have amyloid deposits, which are seen in amyloidosis. This is a amorphous material which is deposited in the cornea. Then we have calcific or band-shaped keratopathy. Here there are calcium deposits in the cornea. So this usually occurs in a band shape in the center of cornea with calcium hydroxyapatite crystals at the level of Bowman's membrane. So this, the etiology of this band-shaped keratopathy can be divided into either because of ocular causes such as in chronic uveitis, Still's disease, phthisis bulbi, it is end stage of trauma. Then we have keratitis and trauma. So these are ocular causes, and it can also be age related, and there are systemic or metabolic causes like hypercalcemia, which occurs in hyperparathyroidism and also in cases of multiple endocrine neoplasias and all in which there is hyperparathyroidism. The treatment is chelation therapy with EDTA, and in severe cases we can also perform a penetrating keratoplasty or keratoprosthesis. So this was regarding calcific deposits. Then we have Salzmann nodular degeneration. So in this there is a raised hyaline plaques which are deposited between the epithelium and the Bowman's layer. So they undergo degeneration and form a nodular structure. There is destruction of the Bowman's membrane and the stroma, leading to that nodular appearance. These are commonly unilateral and are seen in females. And the etiology of this can be either secondary to trachoma or rosacea keratitis, and also in cases of recurrent flectanular keratitis. Okay, so this is Salzmann nodular degeneration. This is also a axial conditions. So these are the 5 axial corneal degenerations. Now coming to the peripheral ones, we have Arcus senilis. So this is a age-related corneal degeneration. There is which affects the periphery of the cornea. So there is apoptosis of the cell, and there are overload of the macrophages leading to Arcus senilis formation. So there is a white limbal girdle of vogt. So this is similar to Arcus senilis, but the difference is that there is a clear zone in Arcus senilis between the lesion as well as the limbus, that is the peripheral cornea, whereas in the girdle of vogt there is no clear zone, so it is very much near to the corneal periphery. Then are the Hassal henle bodies. So these are dot-like hyaline structures which are seen at the periphery of the cornea. So as we are discussing the peripheral, these are the peripheral ones. If these Hassal henle bodies are located in the center, it is known as cornea guttata. So these are characteristic of cornea guttata. Then we have a spheroidal degeneration, which is also known as climatic droplet keratopathy. These are yellowish or golden deposits which are spherical in shape. These are seen in the periphery. These occur in the areas where UV sunlight is focused, and if they are present in the periphery, it is called grade 1. In grade 2, they will be in the center, and in grade 3 they will be in the center, as well as they will be very thick and also elevated plaque-like lesions. So this was regarding spheroidal degeneration. Then we have other degenerations like Terriens marginal degeneration and Pellucid marginal degenerations. So this Terriens, so as the word suggests, Terriens is related to teres. So teres is upside, right? So that's how we can remember it affects the superior part of the cornea, whereas the pellucid affects the inferior part of the cornea. So this pellucid marginal degeneration has also been linked to a type of keratoconus also. So these are a thinning of the cornea. Okay. So then we have a Moorens ulcer and peripheral ulcerative keratitis. So these are all a separate class. We will discuss regarding this in a separate class. So these are 5 or 6 examples of the peripheral corneal degenerations. So in this way we can easily remember this. Thank you.